Boa tarde a todos. Vamos iniciar mais um seminário da pós-graduação. Agradecendo muito a presença do professor Tomislav. Ele sempre oferece para a gente uma disciplina na pós-graduação. Alguns dos alunos que estão presentes aqui, eles são desse programa de pós-graduação. Então, vamos começar o nosso seminário. Thank you, Professor Tomislav, for accepting the invitation to speak. And
So, thank you. Thank you for the opportunity. Thank you for the wonderful introduction, Anna. Thanks to Tatiana and Juliana, which are also course coordinators. And maybe I would start by saying boa tarde a todos. Espero que estejam prontos para o curso. I don't know if I pronounced it correctly, but I was in Brazil last year with Tatiana and with this course, and I got some of the Brazilian words, so hopefully that was good. But yeah, thank you for coming today for this inaugural lecture for the course Microbiology of Sexually Transmitted Infections. Course is in English. Later we will go through the course structure and what will be the materials that you will be receiving, what are the expectations, and how you, the students, will be examined. But the vision of today's lecture is to give a broad overview of sexually transmitted infections, why it's important to study this subject, to study these microorganisms, to know them, to understand them from the fundamental perspective in order to inform public health at the later stage of the understanding. And in a way, what are the main organisms that we will tackle? And also, I will give a short introduction about myself during this inaugural lecture. I will also show some specificities of Croatia and how the higher education system works in Croatia as well, and also where are the venues and possibilities for collaboration even after this course. So why are sexually transmitted infections important? The sheer fact that more than 1 million of them are acquired every day around the world accentuates the importance, and the most of them have no symptoms at all. So basically each year we have approximately 370 million new infections with one of the 4 sexually transmitted agents, and these are chlamydia, gonorrhea, syphilis, and trichomoniasis, all agents that we will tackle during this course. So more than 500 million people between 15 and 50 years of age are estimated, for example, to have an infection with genital herpes. It's quite common. And for example, human papillomavirus infection, which is associated with more than 500,000 cases of cervical cancer each year. And then it results in basically 500,000 cervical cancer deaths each year. Basically, every person who is sexually active comes into contact with this virus. So it's important to understand that. And almost 1 million pregnant women were estimated to be infected with syphilis on a yearly basis, which can result in many stillbirths, in many newborn deaths. And this is also an increasing problem, especially in Brazil, United States, and also some other countries as well. But it's not only syphilis, the numbers are worsening for other infections as well, which is why we need to acknowledge the increasing significance of this problem, and also why we need to leverage the weak spots of these organisms. We need to understand them to see where are their weak spots so we can address them effectively. And here maybe this will also be tackled in the lectures that you will be receiving. But even now, maybe it would be a good thing to differentiate what is a sexually transmitted infection and what is a sexually transmitted disease. And you will often see these terms used interchangeably in the literature, STI or STD, sexually transmitted infection, sexually transmitted disease. So the primary distinction here in the terminology, it's infection is when you have a microorganism multiplying in human tissues, but potentially without causing any damage. And this is something that you will see it's common with many microorganisms. They are present in the body, but not causing any symptoms, and we call this an infection. On the other hand, disease, we have a disease when tissue disruption occurs. There is a damage to the tissue. Multiplication was progressing so vividly that led to the onset of certain symptoms. and this is when we call something a sexually transmitted disease. But a much broader term is STI, sexually transmitted infection, because it encompasses both asymptomatic and symptomatic sexually transmitted occurrences in the body, so to speak. So STI is today a more preferred term for this type of for this problem. And here, maybe on this slide, I would like to stress that sexually transmitted infections can have a direct impact on sexual and reproductive health. One facet is stigmatization that occurs, because it's psychological. You have an STI, you feel stigmatized. And also sometimes society can be really heavy on the stigma on the people infected with STIs. But also you have many different complications for the human organisms as well. There can be infertility, there can be the development of the cancer, like we mentioned for human papillomavirus, and other gynecological tumors. There can be pregnancy complications with many sexually transmitted agents. For example, if you have a primary infection with chlamydia and gonorrhea in women, usually you don't have any symptoms, but then the infection is untreated and it progresses, and it may migrate upwards from the lower reproductive tract to the upper reproductive tract. It can lead to the pelvic inflammatory disease, which means the uterus gets inflamed, the fallopian tubes gets inflamed, ovaries and pelvic structures. And also it can lead to chronic pelvic pain. It can lead to ectopic pregnancies, to infertility. And like we mentioned, for some microorganisms, to fetal loss, to low birth weight, even eye and lung damage in the newborn. So this is why it's especially important topic to understand, and especially to understand the severe consequences that may arise. So there was a recent study that was published in the journal Lancet Infectious Diseases, and it tackled the global burden and trends of sexually transmitted infections for the period from 1990 to 2019. And in this study, we have seen a considerable variation, up to 5 times, in the burden and trends of STIs across the globe. And this was valid both overall and for particular infections across, but especially Sub-Saharan Africa and Latin America and Caribbean, you can see here in the map, were so-called hotspot regions that had the highest age standardized rates of total sexually transmitted infections in 2019. And yeah, colors here represent differing rates of STIs, but despite that, overall, if you look at overall, the number of infections globally has increased in the time period from 1990 to 2019. Also, younger people have a higher burden of STI than other age groups, and these trends are increasing in younger persons as well. And this study showed, for example, that this is especially pertinent for syphilis. And also what was shown, that males had a higher age standardized incidence rates and more incident cases, but females were overall more affected by STIs because, like we mentioned, some of the disabilities and complications that these infections can lead to are especially pertinent for women. And this is why it's important to have this in mind. And on this image here, you can see this, like we mentioned, the increasing prevalence on STIs. And here it's correlated with social development index. In a way, you can translate this index to the overall development of a country or a region, which also translates to the healthcare development. And the key diseases that we will discuss during this course are depicted here. You can see, I don't know how good you can see, but basically genital herpes is represented in blue, syphilis is represented in purple, gonorrhea is represented in green, chlamydia in pink, and trichomonas in orange. And the geographic distribution of STIs seen here actually is consistent with previous findings by the World Health Organization in 1999, which identified some of the regions like Sub-Saharan Africa, South and Southeast Asia, and Latin America as regions that have the highest age standardized incident rates of these diseases. And the study also pinpointed several, I would say, risk or contributing factors in these areas, why it's the highest in these areas. And of course, it's poverty or limited access to healthcare, but also generally lower awareness about sexual health and STIs, inadequate screening, also lower maybe availability for treatment options. These are all factors that collectively and like in a group way render low-income countries more vulnerable to STIs when compared to high-income countries. So maybe this can be seen as a pointer where we need more increased attention, where we need more healthcare resources in order to tackle this problem effectively. And there are some studies that were published this year, also on the global burden of sexually transmitted infections, that also emphasize some interesting aspects. So we just had the Olympics, so also there is a role of international travel in spreading these infections. The world is increasingly interconnected. And some studies looked at the specific age groups. So we saw, for example, in a recent study, there was a large increase in HIV burden in older individuals in Eastern Europe, in Central Asia, also in Asia Pacific. So these are trends why we need to be vigilant and why the knowledge on STIs will be indispensable in the future. Obviously, the problem is growing, and that's not the only problem. Drug resistance is also one of the public health concerns, and it's also pertinent for sexually transmitted infections, especially for gonorrhea. And on this CDC graph, you can see that whenever we have a new antibiotic against Neisseria gonorrhea introduced, for example, into the population, into pharmacies, the microorganism quickly evolves to become resistant to this antibiotic. And it's a huge problem, especially for gonorrhea and Neisseria gonorrhea. You will see during this course. For some other bacterial STIs, such as chlamydia trachomatis, it's not such a big problem. You will see why, because this organism has a specific life cycle. But, for example, consider the significant issue of drug resistance that we encounter in the case of HIV, human immunodeficiency virus. So this arises, we see it. It's a problem that undermines a substantial portion of the treatments that we currently use. But also be aware, and we will also talk about this during the course, we use these drugs also for prevention, for preventing the infection with HIV, and also hampers the effectiveness of these drugs when drug-resistant strains start to spread. So this is very important, not only on the personal treatment clinical level, but also on the epidemiological level as well. And there is a recent modeling study, now back to bacterial infections, that there is a potential time frame of approximately 1 decade before resistance to the current drugs that we use in treatment of gonorrhea can reach critical levels. So in a way, we have this window of opportunity to strategize and plan for the responsible use of antibiotics in order to slow down the development of the resistance in Neisseria gonorrhea, but we then also buy some time to dedicate our efforts to development and assessment of new antimicrobial agents. And also it's critical, we also mentioned HIV resistance. It's critical to adhere to the medications prescribed for HIV diligently, because decline in adherence can worsen the transmission of drug-resistant strains. And this is the topic that you will see in the medical literature. It's always emphasized as a cause of concern. It emphasizes the importance of monitoring and proactive measures to basically address these adherence issues in HIV therapy as soon as possible. But also all of these studies always address the broader context of antimicrobial stewardship, or how to use antibiotics prudently. That's basically what this concept says. So you see, there is a big potential for mitigating the spread of STIs and reducing this burden of adverse effects, and in reaching our ultimate goal to enhance people's overall well-being. So there is basically some blueprints how to effectively tackle them. The World Health Organization, for example, has devised the global health sector strategy on STIs, which got approval from the World Health Assembly. But what can we do? What can we do in addressing this challenge? Basically, we can acquire this comprehensive knowledge about these causative agents behind these diseases. And if we get these profound insights in the microbiology of STIs, both in the fundamental way, in the clinical way, like it will be offered in this course, then we can pave the way for better diagnostic approaches. We can pave the way for informing drug development, vaccine development, and all of this in turn can translate to a huge public health effect, global health effect in that matter. So this is why this is a topic of utmost importance for the global level, but fundamental level, like it will be offered in this course, is a start, is basically a seed from which we can then grow everything in the treatment area, also in the prevention area and global health area. So I will just say a couple of words about myself. Basically, I finished med school at the University of Zagreb in Croatia. And then quickly, I also started at the same university PhD studies in biomedicine and health. And since then, I was already interested in sexually transmitted infections. My topic was on chlamydia trachomatis. And I was also already interested in antimicrobial resistance. So I basically wanted to explore. This was a sensitivity survey. And we explored 3 drugs, azithromycin, doxycycline, and levofloxacin, against urogenital clinical chlamydia trachomatis strains. And my clinical work was very interesting, but as years passed by, I was more and more interested in public health aspect of not only sexually transmitted infections, but infections in general. So I finished a master in public health at London School of Hygiene and Tropical Medicine. And also concurrently with my PhD training, I had a residency in clinical microbiology, 4-year residency, so I'm a specialist in clinical microbiology as well. I attended some clinical trials, trainings at Harvard Medical School, and also due to my clinical work, I also had a patient male clinic for STIs. I was also able to take an exam in sexual medicine. So I'm also a sexual medicine specialist, which was awarded by the European Multidisciplinary Committee of Sexual Medicine. Regarding my academic appointments, I'm an associate professor at the University North in Croatia. That's my primary affiliation. I also teach at some other universities in Croatia, but I'm also affiliate associate professor at the University of Washington School of Medicine at the Department of Health Metrics, where I conduct these global burden of disease studies. I'm also a mentor in some courses, for example, at the London School of Hygiene and Tropical Medicine. And basically, courses that I cover at the university are linked to microbiology, but also hygiene and epidemiology and public health. And at my university, I'll also have an elective course, sexually transmitted infections in clinical practice, which is maybe kindred to this one, not completely the same because we don't tackle it from such a fundamental perspective that it's important for you. They are nursing professionals, future nursing professionals, so they need more clinical approach. But don't worry, you will get both clinical and fundamental approach in this course as well. So basically, I also wanted maybe to highlight my work at the Institute for Health Metrics and University of Washington School of Medicine. We were basically behind the biggest global burden of antimicrobial resistance study that was published 2 years ago, and now we are preparing some also new publications that will not only see the time trend of the global burden of antimicrobial resistance from 1990 to 2021, but also forecast how the problem will develop until 2050. But this capstone big study from 2022 showed that basically almost 5 million people who died in 2019 suffered from at least one drug-resistant infection, or they died with at least one resistant microorganism in their test results. But we also showed that resistant microorganisms were directly responsible for approximately 1.3 million deaths in 2019. And yeah, basically common infections such as lower respiratory tract infections, bloodstream infections, and intra-abdominal infections are now killing hundreds of thousands of people every year because bacteria become bacteria became resistant to treatment. And basically, yeah, this includes historically treatable illnesses like pneumonia, like foodborne ailments, but also increasingly healthcare-associated infections. So everybody is at risk from AMR, but this study and this data show that young children were particularly affected. And in 2019, 1 in 5 deaths attributable to AMR occurred in children under the age of 5, often from previously treatable infections. So this resistance really had an impact. And maybe counterintuitive, but Sub-Saharan Africa faced the highest burden, with more than a quarter million deaths due to AMR in just 1 year. And especially high numbers were for vaccine-preventable diseases like Streptococcus pneumonia. If you get a resistant strep pneumo, you can die, but with an infection, you would prevent even the infection itself. The problem is that Sub-Saharan Africa faces such a huge infection burden in general that, of course, there is a high resistance burden as well. And the other facet of the problem in high-income countries are those healthcare-associated infections, which are very, very commonly resistant, which are also increasing. So these are some of the findings behind this project. And basically, last year when I was in Brazil for the microbiology conference, I showed some of the results from the burden of Group B strep in Brazil. So for 2019, there were 7,500 deaths due to strep B in Brazil. And you can see here that basically a quarter of these deaths were due to resistant strep, Group B strep. So this is important to take in mind, and also to have in mind that not only resistant strains are a problem, but also susceptible strains from infections that can be prevented. Maybe in the future will be. I know this group in Brazil is actively working towards Group B strep vaccine, and I hope we will see this vaccine soon to prevent this, which is also a high burden. You can see this Group B strep is basically among top 10 bacterial agents that cause infectious burden in 2019. This is something that should be preventable in the near future. So basically, my clinical work entails I'm a director of a clinical microbiology laboratory in the private healthcare sector in Croatia, also coordinator of the reproductive health center within that clinic. I'm an advisor for certain companies on AMR and antibiotic development. Previously, that was for Pliva company, the biggest pharmaceutical company in Croatia, but also advise some, for example, UK companies on AMR. And I'm an expert evaluator for the European Commission for different grants and scholarships. So evaluate research proposals made by people who want maybe to start a certain research project. During my work, I'm interested, of course, in both antimicrobial resistance and STI field. I try to blend these two domains as effectively as possible, always in my work. And yeah, I think you will see from my profile, there are some studies, for example, that cover different, not only aspects of STIs, not only different pathogens, but also different parts of the world, from global to some Asian countries. But of course, most of the studies that I have conducted were based in Croatia. And they stem from epidemiological research to case reports and clinical reports. One of the pathogens that we will just mention during this course, we won't cover in depth because it's seldom isolated, but it's Corynebacterium glucuronalyticum, because I would consider it an emerging pathogen. It was just recently recognized as a potential cause of urethritis in men. So basically, I proposed and devised the first classification of clinical urogenital syndromes in men caused by this bacterium. And also, what I have noticed and described is maybe it can arise after treating chlamydia trachomatis infection. So I devised a new term, uncloaking urethritis, for when this corynebacterium appears after the treatment of chlamydia trachomatis. And you will see during the course, we will also cover mycoplasma infections. And I also did some work, especially screening for mycoplasma and what is the need for screening in high-risk and low-risk population. This is something of my interest as well. So you basically saw in the global burden of AMR study, maybe I didn't emphasize it enough, but the leading pathogen, the leading resistant pathogen was E. coli. And since we have such an emergence of antibiotic-resistant strains of E. coli, since we have such high infection rates, and especially problematic in urinary infections, we have a high infection recurrence rates. Basically, there is a need for new approaches that will efficiently treat and prevent urinary tract infections. So you probably studied E. coli. You know that, for example, uropathogenic E. coli has adhesive organelles as principal virulence factors. Maybe this is something to explore and maybe to devise anti-adhesion strategy as one promising treatment option. Basically, if you block adhesion strategy of a certain pathogen, it cannot adhere, for example, to a certain epithelial cell or a certain anatomical niche, and the infection won't arise. So with my research group at University of Northern Croatia, we proposed an anti-adhesive dual targeting approach. And this approach was towards adhesive proteins placed on two key virulence factors for E. coli, type 1 Fimbria and P. pili. And we call it a dual antagonist approach. Basically, our dual antagonists contain mannose and natural cranberry containing polyphenols joined together. So in that way, we efficiently blocked the infection and prevented the spread and progression of disease. We published some ideas, and this is now further under development. And we believe this anti-adhesive strategy basically is the future of treating these multi-resistant infections. And several years ago, I published a study where we appraised whether the encapsulation of antibiotics in liposomes can be considered an effective approach to improve not only local effects, but also bioavailability, biocompatibility, also antimicrobial activity of drugs. And we did it in the example of chlamydia. And these liposomes, they got famous, for example, when COVID vaccines got developed. mRNA COVID vaccines that use liposomal encapsulation, that use liposomes. So basically, this was a similar approach, but in these liposomes were antimicrobials, and we wanted to test whether liposomes could enhance the antichlamydial action of azithromycin. So we encapsulated azithromycin in different surface charge elastic liposomes, and then we assessed their antibacterial potential against chlamydia trachomatis. And we basically show that this not only improves effectiveness, but maybe its local use may be improved with such approach, and maybe we could use some antibiotics that we can't use locally traditionally, like azithromycin. Finally, we would be able to use them locally. And this also was an interesting study. So on antimicrobial resistance, together with Tatiana, your course coordinator, we organized some courses. For example, I always mention this hugely successful track hub session that was held during ASM Micro 2018 in Atlanta, which was called the Global Scenario of Antimicrobial Resistance. Do developing and developed countries share the same threats? And we discussed especially from the aspects of pneumococcus and some other microorganisms. But also, I was antibiotic action champion of the British Society for Antimicrobial Chemotherapy, and I'm still involved in different aspects. I will mention it a bit later in AMR, because these type of topics, these type of things, always ask not only for your clinical engagement, but also for policy engagement and trying to influence the policy, how to protect certain nation or certain region from resistant threats. From some other projects, I was involved in first human microbiome project in Croatia. We basically compared people with Crohn's disease and ulcerative colitis with healthy individuals to see how their microorganisms differ. We found some differences in certain bacterial taxa. I won't go into details now here because this is not the topic of this course, but this is a field that is still one of the most attractive fields in microbiology, microbiome research. And undoubtedly you will come into contact with microbiome research. So if you have any questions or want me to share some of the data from these studies, feel free to reach out. So as I mentioned, policy aspect is important, but also science communication, communicating the findings and basically translating the findings in a digestible way for the general public is also one of the key roles of a scientist. So I always try to do that as well, and I was involved in several news outlets and portals trying to convey the problem to the broad audience. And basically you can find some of my articles online as well. And continuing with that policy work, I'm also involved in one UK NGO, non-governmental organization, Healthcare Information for All, or HIFA. I'm country representative for Croatia, but also a global coordinator for country representatives. And this is where a lot of people gather to exchange experience, to exchange thoughts. Basically, this is the organization with a vision. A vision is that the whole world had access to healthcare information. This NGO has more than 20,000 members, and this includes scientists and health workers and librarians, publishers, researchers, policymakers, and it's also rich in supporting organizations. So this is also somewhere where you can get involved. I got involved, for example, HIFA is now an official organization from the World Health Organization, and we developed certain policy briefs on the quality of health services on a global level. What is maybe interesting for you is that HIFA members interact on 6 global forums in 4 languages. So basically there is also a Portuguese language where you can maybe get involved and start a discussion of the topics of interest. And I was also an active member in the European Sexual Medicine Network. It's one of the biggest European networks for sexual medicine, and I was the lead or chair of Young Researchers and Innovators group, where we also tried to implement certain aspects that we found important in sexual medicine and sexually transmitted infections, especially participation of researchers from, so how would you frame it? Maybe we tried a decolonization study approach to include more researchers from Global South to participate in our studies, to participate in the global work. Previously, I was education officer in your ESCMID study group for Mycoplasma and Chlamydia infections. ESCMID is European Society for Clinical Microbiology and Infectious Diseases. It's the biggest society for infections in Europe. And now I'm officer in the executive committee for ESCMID AMR Action Committee. It's the new committee that started this year. And basically, you see how the world develops. The AMR is getting increasing recognition. It will be, so on 26th of September, there is a UN global meeting where the only health topic that will be discussed will be antimicrobial resistance, or AMR. So this is something on the radar for the whole, not only scientific community, but also political community now. And ESCMID also realized this is important. And this is why in this course we will also show certain attention to antimicrobial resistance and the mechanisms of these STI microorganisms. How do they develop antimicrobial resistance? What to do now? And I know you're not clinicians, but also we will mention primary treatment options and what to do when they become resistant to certain antimicrobial agents. So how this course is planned, basically is planned to go during 1 month. The total content is 30 hours. It will contain 15 hours of video lectures and 15 hours of your independent studies. And basically the course will take place on the Google Classroom. So the concepts that you will get here, we want to convey advanced microbiological knowledge of pathogens causing sexually transmitted infections, explore these rising resistance trends, and basically also highlight diagnostic procedures and tests that are used in diagnosing them and how the tests function. This is important for you. We will also cover, like I mentioned, microbiome is increasingly important in research. We will also cover the microbiome of the human reproductive system. And also you will have one lecture on preventative options, one lecture, for example, on probiotics, how we use them in STIs, etc. So I think it will be a nice spread of lectures, and I think we will convey the knowledge you need in these hours. And basically, our learning outcomes are for you to have a broad knowledge of relevant microorganisms that cause sexually transmitted infections, to understand the wide array of diagnostic methods, to understand how they cause the disease, and how the chemotherapy or antibiotics work in halting the infection cycle. Basically, also to have a broad knowledge of epidemiology, to have a broad knowledge of reproductive tract microbiome, and for which microorganism we have preventative options, such as vaccination, and what are other modes or modalities of prevention for maybe some other microorganisms that don't have vaccine as an option. And basically, we will try to make you work in teams, to collaborate, to discuss the course material, but also to apply this knowledge in analyzing recent research papers and case reports and real-life scenario examples. So this then is translated to grading scheme. The grading will consist of 4 parts. First and second part will be a short essay. Each of them will contribute 25% of the grade. Then you will have a case report presentation. It will be held virtually on the last day of the course, where each of you will get 1 case report, a real journal published, peer-reviewed medical case from Brazil, and you will make a presentation, which will consist of 25% of the grade. And finally, this date will be announced on a later date, but you will have a short quiz online as a final prerequisite for your assessment, and this will consist of 25% of the grade. Don't worry, it was never hard. Everybody passed it with flying colors before, so I'm not overly worried that you will have any problems with this short quiz at the end, but also with the essays and presentation. I think previous generations did a wonderful job. I'm confident you will look good as well. So during this course, you will get video lectures under previously announced and previously published schedule. And each video lecture will cover 1 topic and is self-standing. So basically you don't need to go through these video lectures chronologically. You can watch each video lecture, and basically you won't lose anything if you don't go into chronological order. It's advised for you to go into chronological order, but you don't have to. Each video lecture will be self-standing. You will also get PDF of the presentation, and both video lecture PDF will be your learning material, primarily learning material. I will provide you some supplementary and optional reading materials together with video lectures. Maybe they will help you in developing short essays, but they're not obligatory for you to go through. So today we have this presentation where I try to introduce some of the aspects why this is a global health problem, why it's a global health issue, and the burden of sexually transmitted infections. But starting tomorrow, you will start to get those video units, those video lectures and presentation PDFs and supplementary material. So tomorrow you will get 2 video lectures, 2 video units that will cover both tomorrow and the day after. So basically on Monday, you will get 4 video lecture units. You can go through all 4 of them on the same day, but the suggested approach is that you take them on these dates. So each day you listen to one video lecture, go through the material, think about it, and then you have basically the full schedule for the whole week. And if you follow this diligently, then even the tasks will come naturally and will not be hard for you. So basically, 1 week after uploading these 4 lectures on bacterial STIs, there is a deadline for your first independent study task, for your first short essay that covers fundamental microbiology, bacteriology of STIs. And here you will be tasked to compare and contrast immune evasion mechanisms of bacterial sexually transmitted agents. And this is your assignment due, August 26th. And you can send all your assignments to my email. You will get personalized feedback. And it's often helpful. So feedback that were provided for the students during independent study task 1 or after independent study task 1, students used to develop their independent study task 2, and it was much, much better. So any feedback you get, don't take it too harsh, too critical. It's only intended for you to, it's only intended to help you to develop your tasks as efficiently as possible. So on that day, 26th of August, you will get 3 video lecture units covering viral sexually transmitted infections on HIV, HPV, and other viruses, together with genital herpes and viral hepatitis. And second short essay will be based on these viruses. It covers laboratory microbiology, basically diagnostics. And your task in the independent study test 2 will be to compare and contrast testing options for HIV, HPV, and genital herpes. And your assignment due will be, again, 1 week after these video units are uploaded. So you have enough time to prepare them. And it will be the same structure like previous, so 500 words, nothing too long, nothing too complicated. And if you go through the material, I think there won't be any problem in developing these short essays. On 29th of August, you will get 3 video lectures covering parasitic and tropical sexually transmitted infections. It's also something that's often neglected. So the importance of public lice, scabies, it's often neglected, but it can be a huge problem once contracted. So this is something I also want you to go through, and I also wanted to highlight during this course. Or for example, some tropical STIs like lymphogranuloma venereum or chancroid or granuloma inguinale. This is important because you will hear these terms and concepts. It's important to understand the microorganisms beneath and how pathophysiologically they develop. And also vaginitis syndrome. I think that's important because not all vaginitis is caused by sexually transmitted agents. So it's important to understand. And of course, you will get video units on the treatment, prevention, and antimicrobial resistance. And like I promised, it will be 1 video lecture will cover probiotics against sexually transmitted infections. What's the current state of research? Maybe this is a budding field that in the future will be more and more important. And it's important to have basic knowledge about that as well. So independent study task 3 will be the analysis and presentation of case report. Like I mentioned, you will be randomly assigned 1 case report on Google Classroom. This case report is published in peer-reviewed journal. It tackles clinical presentation and treatment of a certain STI in Brazilian patients, and it's by Brazilian authors. And you are tasked to develop short PowerPoint presentation that you will present at the final seminar, which will be held on September 13th, 2024. So, for example, these are some of the publications, case reports you may get. They're also listed in on your Google Classroom. I uploaded already the whole schedule, and you also have links and titles of the case reports you may get. So already you may start to explore them, but this will be much, much clearer after you go through some of the material, some of the video lecture. And the idea is to try to apply the knowledge you have ascertained during the course on certain case reports, on the clinical aspect, to see how much is actually applicable in the clinical realm, in the clinical milieu. So the presentation won't be long, 10 minutes, 10 slides at the maximum, and you will be tasked to address some aspects of the STI in question. What were the clinical features in the infected patients? What diagnosis was pursued? What treatment was introduced? Was there a follow-up? And what are the lessons learned from the case? So you will be asked to send your presentation at the day of presentation to my email. You can send it earlier as well. It's encouraged, but the latest you send it at the day of presentation, and then we have live presentations of your seminars, live discussion. I will be there again live to answer all of your questions. We can always meet live if you have any questions or something that you need to understand better. You can always email me and we can have a live session again. But basically, these functions well via email, via Google Classroom. The discussions were vivid and during less than generations, and I don't see any problem in having the same type of discussions in this academic year as well. And finally, your final independent study task will be the online examination or quiz that will be held after the final seminar. The date will be announced on later. It will be in accordance with the Federal University of Rio. But basically, you will have a multiple choice question format where only one answer will be correct. And it will be 10 questions in total, nothing too hard. If you cover basic aspects of the video units that will be uploaded, I don't think you will have any problems with this final task. Of course, I'm always available at this email address. It's not many of you, but if you want to select somebody to ask me anything on behalf of the students, feel free to do so. And I will be checking my email every day. So whatever you need, whatever additional explanation is needed, if there is a need to change some dates or something in the course plan, feel free to reach out to me. So to end, some facts about Croatia, which is my country. You can see it's quite small compared to Brazil. We became a part of the European Union in July 2013. And we just recently, last year, introduced Euro as our joint currency. And it's not many of us. It's less than 4 million people at the moment. We speak Croatian language. And the problem is also our age structure, our age pyramid is not so well. We have more and more aging population, less younger people, maybe a huge immigration, a huge number of people leaving the country to work somewhere else in Europe or in the States contributed to that trend, but hopefully in the future that may change. And you can see here on the left, Dubrovnik, city of Dubrovnik, maybe one of the most famous cities in Croatia. It's in southern Croatia, fronting the Adriatic Sea. And you have a distinctive old town encircled with massive stone walls that were completed in the 16th century. There was a first quarantine, actually. Dubrovnik also had a problem with plague. And the first quarantine, which means 40 days of isolation, was done in Dubrovnik. So quarantine is basically a Croatian invention. And I don't know if some of you watched the TV show Game of Thrones, but Game of Thrones was filmed in Dubrovnik, actually. It was the King Geoffrey's summer residence. So this is also something of interest. And on the right, you can see Plitvice Falls. It's one of our most famous national parks. It's known for a chain of 16 terraced lakes, joined by waterfalls, and extends in the limestone canyon. And you see a lot of walkways and hiking trails. There are electric boats. I think it's also one of the highlights. We have a lot of tourists coming and visiting Plitvice lakes. And maybe some inventions that you may not have heard about, but that stem from Croatia. We already mentioned first quarantine was in Dubrovnik. But for example, Nikola Tesla, he was born in Croatia. Nikola Tesla, you know, he is the inventor of the first electromotor running with alternate current, one of the most famous scientists in the world. And for example, at the beginning of 20th century, we had a Croat, Eduard Penkala, invented and patented the first real pen. So even the name pen stems from Penkala, the inventor of pen, and also a Croat. And a tie is also a Croatian invention. So in the 17th century, Croats made it a custom to put a piece of textile around the neck as a detail of fashion. And it later developed into a tie, and also a Croatian invention. And basically also in our country, there are a lot of Asian discoveries. For example, in Veliki Brijuni, which is another national park, there are many footprints from dinosaurs. We have ancient arenas. For example, we have a lot of living fossils on the islands. There are 3 years ago, there was a winner of a Nobel Prize that did some work on Neanderthals. We have one of the biggest locations of Neanderthals. It's actually situated in Krapina in Croatia. So we have a lot of ancient stuff going on there in our country as well. And we are proud to be good in sports as well. For example, we have the most decorated Olympic skier of all times, Janica Kostelic. We were twice third in the World Cup, in 1998, in 2022. And in 2018, we were in the finals. We won silver in the end. We also have Wimbledon and US Open champion in tennis. We amassed 2 Davis Cup wins. So yeah, we also got several golden medals on this Olympics. So yeah, we are proud to be good in sports as well. And finally, some information about the higher education system in Croatia. We have 55 institutions of higher education in Croatia, attended by more than 150,000 students. We have 9 public universities. University North is one of them, where I teach. But the oldest continuously operating university in Southeast Europe is University of Zagreb, founded in 1669. And basically, the University of Zadar, it's one of the oldest universities in Europe overall. It was founded in 1396, but it had a period of inactivity. And the renewed University of Zadar started in 2002. We also have private universities, especially of applied sciences. Basically 9 public universities, which is more than enough for the size and population of our country. And we adhere to Bologna process. Basically, all EU countries adhere to Bologna process now, structured around 3 cycles: undergraduate, which ends with a bachelor degree; graduate, which ends with a master degree; postgraduate, different postgraduate options. One of them is PhD degree. And it's organized according to the system of transferable credits, or European credit transferable credits, abbreviated as ECTS. So basically, when somebody changes a country or wants to study one part of the cycle in one country and another part of the cycle in another EU country, this is basically facilitated with this type of system. And not only European Union countries participate in this, also some accession countries and some other countries in Europe. Basically, this made our life easier, especially for students that change universities or change cities or change countries in their studies. So there are also options to collaborate more with Federal University of Rio de Janeiro. This course is one possibility that we can have, but there is also an option of hosting workshops, conferences, and other events. Apply for joint research projects, applies for visiting professorships, visiting observerships, and creating also joint publications. Of course, shared goals of Croatian universities, Brazilian universities, basically universities around the world, is to disseminate knowledge to a wide academic community, teaching excellence and integrity, but also to disseminate this knowledge to the population as well. If we don't convey what we know and what we can do to help in improving global health, we didn't do much of a job. So this is also one of the prerogatives, and I believe our shared goals. So thank you for your attention. I left 5 minutes for the end if you have any questions or comments. And please, enjoy the course. I hope you will find the materials and the topics of interest. and that you will learn a lot. And if you have any questions, you can always reach out to me. So thank you so much.
Thank you, Tomislav. Can you hear me?
Yes.
Yes. Thank you. Hi, first of
Hi,
all.
Hi.
And thank you, Tommy. So, although this was the first lecture of the course, I have opened up for everyone here in the Institute to join. And we do have one question here in the chat.
Okay.
And so if you don't mind, I'll just say something quickly in Portuguese. So,
Yes.
Okay. Pessoal, se vocês tiverem perguntas para fazer, quiserem fazer as perguntas em português, vocês podem escrever aqui no chat que eu traduzo, tá? So Tommy, Laura would like to ask your advice to young scientists who are willing to engage in scientific societies and act in leadership positions, because you have shown that you have done it a lot.
Okay, yeah, a really interesting question. And I always advise to young scientists to get involved in these societies, because first of all, many of these societies are actively trying to help early career researchers, young scientists. They can fund certain conferences, certain meetings, workshops. They can also engage more in your ideas. And you just need to start. This is how you build your portfolio. This is how you slowly progress. And opportunities will come more and more. So you should find a society of your interest, explore whether they offer certain benefits for early career researchers. I know Tati knows both American Society for Microbiology and European Society for Clinical Microbiology and Infectious Diseases offer these kind of opportunities for young researchers. And not only that you will have professional opportunities for education, but you will meet like-minded people. And especially when you start, you need to create collaborations and bonds and publish something jointly. And this will also open a door for you. So my advice is to not to lose interest, but not to be afraid to join a society, but to remain open to this idea. And I hope also during the course, where many publications will be presented, I also highlight certain societies that may be of interest to you. And maybe this will be the right route for you. Also, a lot of societies offer positions for early career and young researchers, such as ambassador positions. This is offered in ASM, in ESPI, but also, for example, International Society for Microbial Ecology, some other societies. You can become a young ambassador, and this is also a springboard for your career in the future as well. Not only you will be able to collaborate with senior researchers, but you will broaden your network and your connections with younger colleagues. And like I said, this is something where you can start in building your research and professional portfolio. So thanks for the question.
Yes, and by the way, this course is a great opportunity for the students to broaden the network and to learn besides sexually transmitted infections from Tomislav, because as you may have seen during his presentation, he has a lot of things to contribute with, and although Tomislav has been actually giving these lectures and this course with me for, I don't know, 3 years now, Tommy? Maybe
yes.
3. Yes.
Yeah.
So, yeah. And although he has a lot in his plate, he still finds time to contribute with our course. Thank you so much, Tomislav. There is one or another question here. I think so that's the last one. Society, I think she meant the scientific society. You would recommend to us, maybe us from Brazil, I guess.
Yeah, I mean, when international societies are concerned, I think the broadest reach is American Society for Microbiology, definitely. And it has also attractive options for young researchers regarding the fee or the yearly fee that you have to pay for the society. So I think it's a very good start because it covers a lot of areas in microbiology. It's maybe the broadest society in microbiology that there is, because it covers not only clinical but also fundamental, ecological, and now it tackles climate change in microbiology and other important aspects. So I think this is a great first step. You will meet a lot of young microbiologists in American Society for Microbiology, and on top of that, it's called American, but more than 50% of membership are outside the United States. So it's very diverse, and you can basically meet colleagues from all around the world. I met Tatiana through American Society for Microbiology. We were both young ambassadors. And
we're still young.
We're still young.
We're still young, but not ambassadors anymore.
Yeah. So, yeah.
Okay. Thank you, Tommy, and thank you everyone who joined us. And so we are available for the students doing the course. We are available, and everyone else, if you want to reach out to Tommy, feel free to reach out to me also first. Thank you, Tommy.
Perfect. Thank you, and keep an eye for materials tomorrow morning.
Thank you, everyone.
Thank you. Bye-bye.